Cardiac conduction system. The heart has its own electrical system that controls the heart rate and rhythm. 1. The sinoatrial SAW node. Located in the right atrium, the SAW node is often referred to as the pacemaker of the heart. It generates electrical impulses that spread through the atria, causing them to contract and push blood into the ventricles. 2. The atrioventricular AV node. Located at the junction between the atria and the ventricles, the AV node receives the electrical signal from the SAW node. There is a slight delay at the AV node, allowing the ventricles to fill with blood before they contract. 3. The bundle of His and Purkinje fibers. From the AV node, the electrical signal travels down the bundle of His, which divides into right and left bundle branches, and then into the Purkinje fibers. The Purkinje fibers distribute the electrical impulse through the ventricles, causing them to contract and pump blood to the lungs and the rest of the body. Cardiac cycle. The cardiac cycle refers to the sequence of events in one complete heartbeat. There are two main phases. 1. Diastole, relaxation phase. The heart muscles relax, and the atria fill with blood. Blood flows passively from the atria to the ventricles through the open AV valves. 2. Systole, contraction phase. Atrial systole. The atria contract, pushing the remaining blood into the ventricles. Ventricular systole. The ventricles contract, closing the AV valves and opening the semilunar valves, pulmonary and aortic, forcing blood into the pulmonary artery and aorta. Heart function and cardiac output. 1. Heart rate. The number of heartbeats per minute, typically 60 to 100 beats per minute for an average adult at rest. 2. Stroke volume. The amount of blood pumped by the left ventricle in one contraction, usually about 70 milliliters. 3. Cardiac output. Cardiac output is the total volume of blood pumped by the heart per minute. Formula. Cardiac output equals heart rate times stroke volume. For example, if the heart rate is 70 beats per minute and stroke volume is 70 milliliters, the cardiac output would be 4,900 milliliter per minute or 4.9 liters per minute. Blood pressure. Blood pressure is the force exerted by blood against the walls of blood vessels and is typically measured in the arteries. It has two components. Systolic pressure. The pressure during ventricular contraction, the higher number. Diastolic pressure. The pressure during ventricular relaxation, the lower number. A typical healthy blood pressure reading is around 120/80ths of a millimeter of mercury. Common heart conditions. 1. Coronary artery disease, CAD. This occurs when the coronary arteries, which supply blood to the heart muscle, become narrowed or blocked, often due to atherosclerosis, plaque buildup. 2. Heart attack, myocardial infarction. A heart attack happens when blood flow to a part of the heart muscle is blocked for a long enough time that part of the heart muscle is damaged or dies. 3. Arrhythmias. These are irregular heartbeats, which can be too fast, tachycardia, too slow, bradycardia, or erratic, fibrillation. 4. Heart failure. This occurs when the heart cannot pump enough blood to meet the body's needs. It can result from various conditions, including hypertension, CAD, and previous heart attacks. Conclusion. The human heart is a highly efficient organ that works tirelessly to maintain circulation, delivering oxygen and nutrients to the entire body. Its structure and function are closely integrated, and any disruption in its electrical or mechanical components can lead to significant health issues. Understanding the anatomy and physiology of the heart is crucial for recognizing and managing cardiovascular health.
Be like a classmate or family by subscribing to a message when new videos are released. Then ask questions in the comment box.